Hey everyone, welcome back to my channel Dental Cafe. So today we are going to discuss about the venous drainage of the face. Very important topic from NEET examination point of view. Okay, then let's begin the video. So it begins with the facial vein. So first one, we have a supraorbital vein and a supratrochlear vein. They combine to form angular vein, which is continue as facial vein. Then behind the mandible, we have a superficial temporal vein and the maxillary vein. They combine to form retromandibular vein. So retromandibular vein is formed by the superficial temporal and the maxillary vein. And then retromandibular vein is divided into two divisions, anterior and the posterior division. First of all, we are going to talk about the anterior division of retromandibular vein. Anterior division combine with the facial vein as we have already discussed, and then it will form a common facial vein, and then this common facial vein is drained into the internal jugular vein. So the venous drainage of face is mainly carried out by the retromandibular vein and the facial vein. These are the two main vein. Now we are talking about the posterior division of retromandibular vein. So posterior division combined with the posterior auricular vein, as it is coming behind the ear, so it is called posterior auricular vein combined with the posterior division of retromandibular vein, and it will form external jugular vein, which is then drained into the subclavian vein. Basically, we have a two vein which is responsible for the venous drainage of the face. First one is the facial vein and second one is the retromandibular vein, which is responsible for the venous drainage of the face. Just a quick revision in summarized form. We have a supratrochlear and the supraorbital vein which will combine to form angular vein and which continue as facial vein. Then behind the mandible, we have a superficial temporal vein and the maxillary vein, which will combine and form retromandibular vein. Then retromandibular vein is divided into two division, anterior and the posterior division. Again, anterior division combined with the facial vein and it will form common facial vein, which will then drain into the internal jugular vein, and posterior division combined with the posterior auricular vein, which is behind the auricle, and it will form external jugular vein, which is then drain into the subclavian vein. Now, applied anatomy. How venous drainage of the face can be dangerous. It is very important question from the competitive examination point of view. It is very dangerous because infection can spread to the cavernous sinus from the venous drainage of face. In applied anatomy, we have a dangerous connection. We have two dangerous connection to the facial vein from where infection can travel to the cavernous sinus. As you can see in the figure, this is we have a cavernous sinus. So it is connected to the angular vein of the face by superior ophthalmic vein. So infection from angular vein can travel to the cavernous sinus. That is why it is called dangerous connection. And cavernous sinus is connected to the facial vein of the face by emissary vein. So an infection in the facial vein can travel to the cavernous sinus through emissary vein. As you can see, this is we have a pterygoid venous plexus and it is also connected to the facial vein by deep facial vein. That is why these two are the dangerous connection from where infection can travel from face to reach the cavernous sinus. In detail about the dangerous connection and the dangerous area of the face, I'll tell you in the part 2 in continuation with venous drainage of the face. So don't forget to like, share and subscribe my YouTube channel and hit the bell icon for the latest update.